Ed, welcome back to Healthcare Unfiltered. And I reached out to you because it's been 3 months since we taped the initial podcast episodes on the what happened with the AMA and with the JAMA position that you once held as the deputy editor. The podcast episode that we aired gathered a lot of attention. It was watched on Twitter, viewed by more than 30,000 times. And I think a lot of people have reached out to me as well as to you, I believe, in support and solidarity with your position. And they all actually felt that you were not treated fairly. At least I have not received any comments opposite to that. So now that it's been 3 months since we taped the episode, I thought it's fitting to provide listeners, viewers, and everyone with an update into what has happened, what's been going on for the past 3 months, and what are your steps forward. And I realize you can't share everything, but whatever you can share, many people are interested in knowing what's going on. They all want to help, actually, extending a hand, whatever they can. So take us through what's been going on in the past 3 months.
I'm not exactly sure where we left off in the last podcast. So forgive me or stop me if I'm repeating myself from things that were said before. But uh, this was a watershed moment for me. And I'm very glad I had the opportunity to speak with you on your podcast. And the reason is that this issue of the JAMA podcast had been circulating around on social media a lot. And even though we all thought it would go away when people got bored in a few weeks, it didn't. And it just kept going on and on and on for years. And anytime I would make a comment on social media about that event, I would get a barrage of criticism from I'll call them the DEI crowd, but they would go back to how could you deny the existence of racism in medicine? You're a white supremacist, you're a racist, you're tone deaf, you're all this kind of ad hominem criticisms that I got, none of which were based on actual facts because the things they accused me of saying I didn't say. And that's now a matter of record in the courts of who said them. It wasn't me. So every time I pop my head up, somebody would take a swipe at me. This is the first time that I've made a public statement about the events at JAMA and the AMA where there's been overwhelming support for my position. And it's been overwhelming. I mean, it's as the comments you've seen online, and then people reached out, they found my email, reached out to me directly to say that they support my position and they feel bad about what happened to me. So that's a first, and that's been very reassuring. What's important about that is that I got that kind of feedback when all these things were unfolding a few years ago. But the comments in support of me were always attached to some kind of comment like, I just can't say this in public because that was the environment back then that in the heyday of the George Floyd riots and DEI and all that. There was a lot of people who didn't like what was going on, but were silenced. They weren't able to express their opinions. Clearly, that's changed in this past year with the Trump administration. Whether you like them or not, it's affected a change. And now all the people who didn't like what was happening with DEI are coming out of the closet. They feel like they can express themselves. So it's been very, very interesting and reassuring to get the kind of feedback that I've gotten. So thank you for giving me the opportunity to tell my story again.
And in fairness, I did reach out to the AMA and I offered my podcast and my platform to respond to what you said, so at least we can provide both sides of the story, but they have not returned my email. Um, so
I
Ed,
can say on a similar note that we got to this point because after all the dust had settled and they did their investigations and they found that I didn't do it, they've even told me, one of the investigating committees, I didn't do anything wrong, but there was nothing they could do about what the AMA had done to me, and that they had identified who made the statements that were so offensive, and it wasn't me. And that Howard Bachner, even though he wasn't the person, took responsibility for that. He resigned, or was, I found out later, It wasn't like mine. It wasn't a voluntary resignation. He was forced out. And but it all after all that happened, I approached the AMA and said, look, a mistake was made here. My reputation was destroyed, and all I want is some kind of process to undo what happened to me. And they said no. They specifically said we do not want to revisit this issue. And that kind of forced my hand to file the lawsuit that I filed. They would, even though they knew they were wrong, they wouldn't budge. And oddly enough, the guy who made those statements that were so offensive was never publicly identified and never suffered any recourse from that. He continued to work in his position at JAMA and the AMA for at least 3 more years. And they never done anything to the guy. And so clearly the assertion that racism doesn't exist in medicine is false and offensive. And they made a big deal about that, but they didn't go after the person who actually made that statement. They went after me, and I didn't make that statement. And there's nothing I said that even implies that. And they won't give up. To this day, they still are fighting me over this. And so one of the things that bothers me, and I think every physician should take, so part of what I'm doing here, this is costing me a fortune, and I'm now $150,000 into this, fighting against a $600 million a year organization with an entire army of lawyers. But I'm doing it because I think the physician and lay community needs to see what the AMA is all about. And this is coming from the perspective who was a longtime member. I was a member of the AMA from 1984 to 2021, a major donor to their foundation. And when I was at JAMA, I was one of the only ones who was willing to work with the AMA. The AMA was extremely unpopular amongst JAMA editors. I was the only one that would attend their meetings. I was the only one that worked on projects that they asked us to help with. I used to meet with medical students every year at the interim meeting to try to convince them to get involved in the AMA. I was a huge supporter, and this is what they did to me. And they did so without even looking at the facts, without considering the facts. And when they looked at the facts and realized they were wrong, they didn't make any sort of attempt to correct themselves. And to this day, they're still fighting me over this. This is now years later. And I think so, as someone who is a huge supporter of the AMA, to see how they treat their own people who are their supporters, so-called biting the hands that feeds them, anyone who's thinking of joining the AMA or getting involved in the AMA needs to hear my story and understand that this is how they function as an organization. It's a very malignant organization. And it's not what they pretend to be on their, every one of us gets gazillions of social media messages. I get mail every couple of weeks asking me to join. To this day, I just got one yesterday. Please join the AMA. I said, do they realize that they're sending me this when they've tried to make my life miserable? So one of my reasons is to, I was shattered by what they did to me, and I think people need to hear that story, and they need to understand what that organization is all about. And I think the organization needs to be held accountable by the public for what they do and what they really are.
I
The
think,
other is
yeah,
what bothers me is that in my opinion, they're extremely unethical and unprofessional. And why that bothers me is that if you take one of those ethics training courses that we all have to take, and everybody gets these training modules they make you do, they always are based on the AMA Code of Ethics. If you look in the AMA Code of Ethics, what happens when a physician makes a mistake? They go through the usual things we're supposed to do as physicians who make a mistake. You're supposed to acknowledge the mistake. You're supposed to approach the patient, tell them what went wrong, and do something to redress that error. So here in their own code of ethics, they have a plan for what you're supposed to do when you make a mistake. But they, as an organization, when they made a mistake that they know about, didn't follow their own code of ethics. So one thing I think people should do, and I plan to do this, is if somebody gives you a module that's based on the AMA Code of Ethics, say, I refuse to take this. That this organization should not be publishing a code of ethics when they themselves are an unethical and unprofessional organization. And that's not an empty assertion. That's based on fact, based on what happened to me. There's two court decisions that they engaged in libel and defamation. Now, an organization that's promoting ethics shouldn't not tell the truth. And when they're found by a lower court and unanimous appellate court to have not told the truth, they should turn around. It's like saying, okay, you're a physician, you hurt a patient, you shouldn't tell them. Don't tell them. And if the patient confronts you about what happened to them, go after them. That's what they've done to me, and that's not ethical. And so they should follow their own advice. And if they won't follow their own advice, we shouldn't be listening to them, and we shouldn't be forced to use their code of ethics when they themselves are not ethical.
When I last spoke with you, you mentioned that that they are forcing you to pay some legal fees, and you even thought about having a GoFundMe campaign because, again, you are not really you're financially constrained right now with all of this. Has this materialized? Are they still pursuing you for financially?
Yeah, they got the courts to grant $110,000 of their legal fees on a what's called a slap motion. So this is an interesting part of the story in that there's a lawyer here in California whose firm specializes in defamation cases. And I found an article that she wrote that says these slap motions, which basically, if I understand it correctly, if there's some kind of issue that's maybe constitutional, a constitutional issue like protected speech, or in my case, the two issues were protected speech versus and also due process, that you can stop the proceedings and the plaintiff has to prove that there is something going on that's not constitutionally protected. And that if you make an assertion on a constitutionally protected issue and you're wrong, you have to pay the other side's legal fees. She wrote at the time that the exact words were abused process when she was serving as a plaintiff's attorney. And so the AMA hired her to file a slap motion, something she called an abused process. And I have this, at least a part of this article. And so they filed this slap motion saying that they engaged in constitutionally protected activities. And one of the things that happens with the slap motion is that you can't do discovery. You're frozen. You have to make your case based on what you have available to you. So there are at least three aspects of my case that that were involved with this. One that I clearly lost on, that I just was stunned by, was that I wasn't entitled to due process, and that the courts ruled, at least it's a California case because I was living in California, still do at the time of this incident, that the law states that if you're an individual who works for a non-governmental agency, you are not entitled to due process in employment decisions by private organizations. That was stunning to me because I spent 15 years of my career in management, and granted, it was either university or federal. And the standard way of approaching an employee that is a problem is that you do verbal counseling, written warning, suspension, termination. It's that you don't just fight. There's only in medicine there's only a few reasons you can just fire someone flat out, and that's like if you've harmed a patient or you abandoned a patient or something. You've abandoned a patient or something like that, or if you engage in physical violence, things like that. So I'd never heard of the fact that you could take a physician and just fire them with no due process. And that's what happened to me. And it turns out you can. And so the AMA has provided the legal framework for any organization. And now most of us work for private organizations, these big groups and HMOs and whatever. The AMA has shown those organizations exactly how you can fire physicians without due process. Just if they don't like them, you don't want them, tomorrow which is what happened to me on Sunday. They called me and said, we're terminating your employment tomorrow. 3 days after I got an email saying this whole controversy has nothing to do with you. And so I lost on that. So I have to pay their legal fees for that part. The other thing I lost on is one of my allegations was slander, because I know from what people told me that they went to the AMA and they were told various things about me that were patently untrue. I have heard that from those people, but I could not depose them because we were not able to do discovery. So I lost on the slander charge because I couldn't prove it. But I can't prove it because I couldn't get discovery. A third thing was statute of limitations. So I filed my case like a week too late, and some of the statements that were clearly untrue were protected by having occurred beyond the statute of limitations. And there were a lot of those. And then the one I prevailed on, which is a big one, where they published in Time magazine an article referring to the podcast denying the existence of racism in medicine. And then if you tie all the pieces together, that links directly back to me. And the court said that, the first judge said, I read the podcast transcript, I listened to the podcast, and there is nothing in here about racism in medicine. And Dr. Livingston didn't say that, and that is liable. If you say he said it and he didn't say it, and that's not protected speech because your speech is protected up to the point where you're not telling the truth. And because of the way they did it, it also consisted of defamation. They appealed that. So this whole thing got dragged into an appellate court, and the appellate court unanimously affirmed that. Said, "Yep, it's quite true. It's liable. It's defamation." And then they added in another charge called false light, which I think is invasion of privacy. I don't really. They added something back. I don't quite understand it. But all that other stuff, they agreed that I lost on. Well, the AMA filed a slap suit, filed an appeal, and then I had to pay their legal expenses for all those processes for the things I lost on, and that turned out to be $110,000. So I'm in the process of paying them. I already paid 25,000. I got to pay another 25,000 in September, and I have to pay them. So this is kind of
You have
stunning.
a, are you thinking of a GoFundMe campaign?
Yeah, I'm thinking about it. I have to figure out how to set that up and all that. But yeah, based on the kind of feedback I got from your podcast, I think I'll do that because this is killing me. And we're just starting discovery for a trial that's going to occur in July of next year. So this is costing me a lot. It's going to continue to cost me a lot. So I might do
What's
that
the
to.
what's the trial in July, Ed?
That's the trial. We haven't even gotten to trial. We just started. So I filed the lawsuit in 2021. The slap thing has dragged on until about October or November of last year. And then in January, they gave the go ahead to start discovery for a trial that will occur in July of 26.
Um, the I mean, many trials sometimes get settled before they go to court, and who knows what's going to happen between now and July 26. My question is a bit more broad. Do you and your team have concerns about some of the public interviews and the tweets and all of these things ahead of the trial? I mean, is there any concern about conversations on podcasts, media, articles, things of
Oh
that?
yeah, yeah. No, they've every time I've said something, they're monitoring me in social media, and every time I say something, they send it to my lawyer saying, "Tell them not to do that anymore." And so I've gotten a few of those from their lawyers. So
What does your lawyer say?
well, originally he said, "Don't." In fact, when you first approached me, I said no because my lawyer said, "Don't talk about this in publicly or in social media. That they're looking at everything you do and they're going to use it." So, but more recently he said, you can talk about things, refer to publicly available information. I can't talk about stuff that's not publicly available, but there's, the links that you had in your show notes from before, all that stuff's fair game because it's all public and freely available. So he gave me the go ahead to talk about those things. And your podcast is the first time I did that. And I haven't talked to anybody else yet, although I've had offers and have yet to filter through them. But yeah, I haven't talked to too many people.
So, just for folks who are looking for updates, right now you're looking at a trial in July 2026. Between now and then, you are trying to get to the discovery process
Yeah.
and
We
get
have
that.
yet to do the depositions of the people involved and get records and all that kind of stuff. So we're in the middle of that right now.
So now you're allowed to do discovery, or is
Yeah.
it
Yeah.
okay? So that's good. And then what's
I
the
can't say what's in it. All I can say is what little we've gotten from them. Some of it's very revealing. At least for me, having been in the middle of this, is like, oh, really? That person said that. How interesting. So, but I can't discuss any of the specifics just yet.
Well, I
I
appreciate
can
that.
say that in the records, and I think people can probably get these records if they pay for them, the person who said all these things is identified and identified now many times. But in the first lawsuit, the first case, the Superior Court case, he's identified in one of the declarations. And as I mentioned before, the AMA has never publicly identified him. They never did anything to him despite him having made those statements. And if anybody really wanted to find out who that is, they could go. I think you have to, if you can get those records, you have to pay the court to get them. But it's there, and it will be eventually probably available. But I'm just surprised that this guy's gotten away with it.
Anything
And
else?
I'm also surprised, the AMA, another thing about the AMA, they rightly were outraged by that statement that racism doesn't exist in medicine. And it's a ridiculous statement. But for them to have credibility about being offended by that statement, they should have gone after the person who made the statement. So this is another thing about the AMA that I think people need to look at is that they made a lot of noise about health equity, and that was a big initiative of theirs. Interestingly enough, for some reason, the health equity person who caused all this, Aletha Maybank, left the AMA just before Trump took office. So he came in January. She was gone in December. No reason was given for her to leave. As far as I know, she's not employed. So I'm assuming that her leaving was not entirely voluntary. But I think they saw what was coming with Trump, and they've tamped down their DEI initiatives. But they did, health equity was a big part of what they did. And you'd think that if they really believed it, that if somebody made such an offensive statement, that they would have gone after that person, or they would have said, "Hey, you can't do that," like they did to me, except I didn't make the statement. But they should have, when they did identify who that was, and they knew right away who that was, they should have, one, publicly identified him instead of me, and they should have fired him instead of me. But they not only did they not do that, he remained employed at least 3 years later, and he's still affiliated with the organization. So it's like they don't have, in my mind, no credibility in that arena because if they did, they would have done something, but they didn't.
Just there's something that sounds and appears personal to the whole story because it's hard to believe how much you've endured over the past several years. So,
Which I don't understand because I had excellent relations with everybody in that organization except one person who was a fairly low level person who was involved in CME.
yeah,
Had a conflict with her when I was running CME, and this I was the AMA's representative to the ACCME, which regulates CME. And she and I had a conflict about what you call medical education. She's not a physician, and I felt a little. I was kind of upset that I was being overruled at what you count as medical education by someone who's not a physician.
yeah.
But so she had it in for me. But she was the only one that I know of. I had great relationships with everybody in that organization. So I don't get it. I totally don't get it.
The other things people wanted to have an update on is your job. I mean, currently you are still doing some research, and at UCLA, you're not really taking care of patients, or
No, I do. No,
you still are.
I'm at UCLA. So I had been at UCLA. I switched my affiliation from UT South. I was the only one at JAMA who continued to practice medicine. No one who was full time remained active as a physician. And I insisted when I went to work there that I have time to do it. And so for the whole time I was there, would fly to Dallas every other weekend. I came from UT Southwestern, and I'd go to Dallas and attend at the VA, take call, cover the hospital for the weekends every other week for years. And then I switched that process to UCLA in 2018. So at the time of the podcast, I was working at UCLA. The UCLA thing is a whole nother story, which we can't get into now because of the mess UCLA has with the federal government. But I went to UCLA. And then when this all happened, I just devoted my full-time attention to UCLA. And so I'm still there. I take call, I have a clinic, I do surgery, I take care of patients, and but mostly do research. And they had asked me when I went there in 2018 to take what I learned at JAMA about doing clinical trials and set up a clinical trials program in surgery. at UCLA. And that's what I do now. I spend a lot of my time working on research and trying to do clinical trials and doing all kinds of other research and all that. But I do both clinical work and research.
Anything else you want to update listeners and viewers? I know that you're gonna go on other shows and talk to other folks, but
Yeah,
any other updates since the past 3 months since
I
we
don't
spoke?
think so. I just say stay tuned. We're in the middle of some very, very hot things going on with the lawsuit that I cannot discuss, but eventually the courts will decide on those issues, and then we can talk about it some more. But there will be more in the near future.
I'm trying to think who's gonna play you, Ed, on the Netflix documentary. I have to, and I'm assuming you're gonna write a book. We need to talk about that.
Actually, no.
Well, let's talk about it. I'll convince you oppositely. Well,
No, you know why? I try to avoid thinking about this. It's been extremely painful. And
yeah.
so the way I cope is I immerse myself in my research. And so, in fact, I've had sort of an inept response to this whole thing because it's so unbelievable painful. Every time I think about it, I just get depressed and I can't do anything. So I deliberately try not to think about it. So that's why I won't write a book about it. I may write a book about some things, but right now I'm extremely busy with research and that makes me happy. And thinking about this makes me sad. So I'd rather be happy.
Dr. Ed Livingston, thank you so much for coming on again and just giving some updates. And I'll be tuning in to the other shows when you're gonna give
Yeah.
this. I really appreciate you coming on.
Thank you. Thank you. Thank you for giving me the opportunity to tell my story.